So this outbreak has sparked questions about the virus, so helping us answer some of them is Dr. Dean Blumberg from UC Davis Health. Thanks so much for joining us. Look, we have 3 people tied to this ship who are from California. How concerned should we be about human-to-human contact?
Well, human-to-human transmission is very rare, and it has to be very close contact, intimate contact. So the cases that have been transmitted human-to-human with this virus have been like from a patient to a nurse or like husband to wife. So it's not going to be casual contact.
All right, because when you hear people are dying, it makes you very concerned. But I'm curious, what are the symptoms, just in case, what are the symptoms people should watch for?
Well, the interesting thing and the scary thing about hantavirus disease is it happens really fast. So people start feeling ill, and then all of a sudden they're in the ICU like within a day or 2. People get so sick so fast, they can't get oxygen. Their lungs get so inflamed so quickly, they just can't get oxygen. Many of them are on ventilators, and a lot of them end up on heart bypass machines, on ECLS or ECMO, to really bypass the lungs to get oxygen into their blood.
So you mentioned the ventilators. It makes me think back to COVID, and you know, there are some people concerned about this spreading, hearing how serious it is. What do you want to say to people who are maybe making comparisons to COVID on this?
Yeah, this is nothing like COVID. So when COVID started, just the original COVID, when it started, for every person with COVID, they would transmit to 2 to 4 other people who were susceptible, and by casual contact. With this, it's probably less than half with intimate contact, a 0.5 compared to 2 to 4, and that's with intimate contact. So it's nothing like COVID in terms of transmissibility.
So who is most at risk?
People who are going to be at risk for person-to-person contact are those with intimate contact with somebody who is symptomatic. And the incubation period, the time from exposure to development of symptoms, is quite long, 1 to 6 weeks. So that can occur many weeks later.
And he wanted to add, but the people who have ties to California right now, the state knows where they are and are monitoring them.
Yeah, California Department of Public Health knows where they are. They're monitoring them, symptom monitoring, and keeping an eye on things to make sure there are no further cases of transmission.
As always, we appreciate your expertise. Thanks for coming in.
Hey, thank you.
All right. And right now on the KCRA 3 app, our Hirsch data team takes a closer look at the hantavirus cases over the years, including the most recent CDC report. You can also find that on KCRA.com.